Welcome to part 2 of 3. This part of our training is on sexually transmitted diseases, or STDs. And this session will provide a comprehensive overview of how STDs are transmitted, the body's immune system response to these infections, and the factors that influence the spread and susceptibility of these diseases. We'll explore key concepts related to the agent, host, and environment interactions, modes of transmission, incubation periods, human anatomy, and essential vocabulary. So let's dive in. STDs are primarily spread through sexual contact, including vaginal, anal, and oral sex. They can be caused by different infectious agents such as bacteria like chlamydia and gonorrhea, or viruses like herpes and human papillomavirus, and parasites like trichomoniasis. Understanding how these agents spread is key to preventing transmission and managing infections. So, when talking about the agent, host, and environment interaction, the agent refers to the pathogen, so the bacteria, the virus, or the parasite that causes the STD. The host is the person who becomes infected with the pathogen, and the host's immune system plays a crucial role in either fighting off the infection or becoming symptomatic. And then the environment includes all the external factors that affect transmission. This might involve the physical environment, like the warmth and moisture that can help bacteria survive, and social factors such as behavior, condom use, and access to healthcare. So, as far as modes of transmission, we're going to talk about direct contact. So, STDs are commonly spread through direct contact with infected body fluids such as semen, vaginal fluids, blood, or through skin to skin contact with an infected area like genital herpes or HPV. There's also mother to child transmission. So, some STDs like syphilis or HIV can be transmitted from mother to child during childbirth or breastfeeding. And then there's also indirect contact. So, although this one is less common, some STDs can spread through sharing contaminated needles or unsterilized medical equipment. And the incubation period refers to the time between exposure to an infection and when symptoms first appear. So for STDs, this period varies wildly. For chlamydia and gonorrhea, symptoms may appear within 1 to 3 weeks. For syphilis, the first signs can appear 10 to 90 days after exposure, and genital herpes can show symptoms within 2 to 12 days. So during this incubation period, a person may not show symptoms but can still be infectious and transmit the disease to others. The body's immune response to an STD can vary depending on the type of the pathogen and the person's overall health. For example, when exposed to bacterial STDs like chlamydia or gonorrhea, the body's immune system may respond with inflammation and discharge, trying to fight off the infection. However, some people may not show symptoms, leading to undiagnosed infections and continued transmission. For viral STDs such as herpes or HPV, the virus can hide in nerve cells or skin cells, evading the immune system completely. And this allows for periodic reactivation and potential transmission even when no visible symptoms are present. Understanding how STDs affect various parts of the body is crucial for accurate diagnosis, effective treatment, and prevention strategies. Different STDs target different areas, and the symptoms can vary widely depending on the site of infection. Here's a more detailed look at the anatomy involved in STD transmission and types of infections. The genital area is the most common site affected by STDs. For individuals with a vagina, infections like chlamydia, gonorrhea, trichomoniasis, and genital herpes can affect the cervix, vagina, vulva, and urethra. Symptoms may include unusual discharge, painful urination, itching, sores, or ulcers. For individuals with a penis, STDs such as gonorrhea, chlamydia, syphilis, and genital herpes can affect the urethra, scrotum, and penis, causing symptoms like discharge, pain during urination, sores, or swelling. Human papillomavirus, or HPV as we know it, can cause genital warts, which may appear on or around the genitals and anus in both men and women. Then, when talking about the anus and rectum, STDs can also infect the anal and rectal areas, particularly in individuals who engage in anal sex. Infections such as gonorrhea, chlamydia, syphilis, and herpes can cause rectal symptoms like pain, itching, discharge, or rectal bleeding. And some individuals may experience inflammation in the rectum, which can lead to discomfort and urgency to pass stools. Anal HPV can lead to the development of warts and, in some cases, precancerous lesions or anal cancer. And oral sex can also transmit several STDs to the mouth and the throat. Infections like syphilis, gonorrhea, herpes, and HPV can cause symptoms ranging from sores or ulcers on the lips or inside the mouth to a sore throat, redness, and swelling. Gonorrhea in the throat or pharyngeal gonorrhea might not show symptoms but can still be contagious. Herpes may cause painful blisters or cold sores around the mouth. Oral HPV can result in lesions or rarely cancers of the mouth and throat. And while less common, some STDs can also affect the eyes, particularly if infected fluids come in contact with the eye area. Chlamydia and gonorrhea can cause conjunctivitis, leading to redness, irritation, discharge, and swelling of the eyes. Herpes can also infect the eyes, potentially causing a painful condition known as ocular herpes, which may lead to vision loss if left untreated. Certain STDs, such as syphilis and herpes, can cause visible symptoms on the skin. Syphilis often presents with painless sores or kinkers at the site of the infection, which can be on the genitals, anus, lips, or fingers. Secondary syphilis may cause a widespread rash, often on the palms and the soles of the feet. And herpes can cause blisters or sores that appear on any skin that's come in contact with the virus. Untreated STDs can lead to several complications in the reproductive system. For example, untreated chlamydia and gonorrhea can lead to pelvic inflammatory disease, PID, in individuals with a uterus, causing inflammation and scarring of the fallopian tubes, uterus, and surrounding tissues, potentially resulting in chronic pelvic pain, ectopic pregnancies, or infertility. In individuals with a penis, untreated gonorrhea or chlamydia can lead to an infection of the tubes that carry sperm, causing pain, swelling, and in rare cases, infertility. Certain STDs can progress to affect internal organs if left untreated. So, for example, syphilis can enter a latent stage and over time cause severe damage to vital organs, including the heart, brain, liver, and nerves, potentially leading to cardiovascular complications, neurological issues, or even death. Hepatitis B and C, although primarily affecting the liver, are often classified among STDs because they can be transmitted through sexual contact. These infections can cause liver inflammation, scarring, or cirrhosis, liver failure, or liver cancer. And some STDs can impact the immune system, making the body more vulnerable to other infections. For example, herpes simplex virus may cause recurrent outbreaks, which can be more frequent or severe in individuals with weakened immune systems. Additionally, people with STDs such as syphilis or gonorrhea may have an increased susceptibility to contracting other STDs due to inflammation and open sores, which provide an entry point for additional pathogens. So let's take a moment to talk through some key terms that you'll come across when dealing with sexually transmitted diseases. Understanding these words will help you communicate more clearly and confidently with clients and colleagues. So first up, there's the word asymptomatic. And that's a big word, and it just means that a person doesn't show any signs or symptoms of an infection, even though they might still have it. Many people with STDs fall in this category. They feel fine and might not even know that they're carrying an infection, but they can still pass it to others. And then we have the term carrier. And a carrier is somebody who has the disease-causing organism in their body, but isn't showing symptoms. They can still spread the infection to others without even realizing it. The incubation period that we already talked about is the time between when a person is exposed to infection and when symptoms first appear. This can range from a few days to several weeks, depending on the STD, and it's a bit like the infection is in a waiting period before it makes itself known. Then there's a latent infection, and this is when an infection is present in the body but is inactive or dormant and not currently causing any symptoms. And the tricky part is that these infections can sometimes become active later on. So even if someone isn't feeling sick now, the infection could still cause problems down the line. The word pathogen is a general term for any bacteria, virus, or parasite, maybe just consider it a germ, that causes disease. In the case of STDs, we're talking about pathogens like bacteria that cause chlamydia or the viruses responsible for herpes and HPV. Screening is a crucial part of managing STDs. It's all about testing people who may not show any symptoms but could still have an infection. Screening helps catch these silent infections early so they can be treated before they spread to others. So let's talk about vaccines. There are preparations given to people that stimulate their immune response to help prevent certain infections. So for example, we have vaccines for some STDs like HPV and hepatitis B. And these vaccines are great tools to help our fight against these infections because they help protect people before they're even exposed. And while we're at it, I know that this training is called TB STD, but actually there's been a terminology update and the training hasn't quite caught up yet. So the term sexually transmitted infections is now preferred over sexually transmitted diseases. And so this shift just emphasizes that not all sexually transmitted infections result in disease. Some infections might be asymptomatic or might cause only mild symptoms, but still have the potential to be transmitted. So using STI is more inclusive and accurate because it encompasses both infections that cause symptoms and those that don't. So there you have it. That's just a quick rundown of some key STD or STI related terms that will help you navigate these conversations a little bit more with some ease and some confidence. So think about these words as part of your toolkit as we're providing the best care and education to your clients. So let's dive into the different types of sexually transmitted infections or STIs. I know this might feel a little bit like a biology class, but just hang in there knowing that we're dealing with something that's really essential to providing the best care possible. So first up, we have bacterial STIs, and these are infections caused by bacteria. Tiny, single-celled organisms that can thrive in our bodies under the right conditions. Two of the most common bacterial STIs are syphilis and gonorrhea. Syphilis is a tricky one. It often starts with a painless sore called a canker, which can disappear on its own, giving people a false sense of security. But left untreated, syphilis can cause severe health problems years later, including damage to the heart, brain, and other organs. Gonorrhea often presents with symptoms like pain during urination or unusual discharge, but it can also be silent, especially in people with the cervix. The good news is that both syphilis and gonorrhea are treatable with antibiotics if they're diagnosed early. When we're looking at viral STIs, unlike bacteria, viruses are much smaller and require our cells to reproduce. Some of the most common viral STIs include herpes, hepatitis B, and genital warts. Herpes can cause painful blisters or sores and can stay dormant in the body, flaring up when the immune system is weakened. Hepatitis B affects the liver and can be spread through sexual contact or other means like sharing needles. And HPV is tricky because some strains are linked to cancers, such as cervical cancer. And here's a reality check. Once you contract a viral STI like herpes or HPV, it stays in your body for life. But don't worry, there are treatments to manage symptoms and vaccines to prevent infections like HPV and hepatitis B. So we also have chlamydia, which is a unique bacterial infection and one of the most common STIs. Chlamydia often flies under the radar because it's frequently asymptomatic, especially in people with a cervix. If left untreated, it can lead to serious complications like pelvic inflammatory disease, which can cause infertility. The bright side, chlamydia is usually really easy to treat with antibiotics once it's detected. And then we don't want to forget about fungal infections like yeast infections. Although yeast infections are not always sexually transmitted, they can be passed through sexual contact. Caused by fungi such as candida, yeast infections thrive in warm, moist environments and can lead to itching, burning, and discharge. Thankfully, antifungal medications can usually clear them up quickly. Then there are metazoan infections, which might sound like something out of a sci-fi movie, but we're talking about tiny parasites like scabies and pubic lice, often called crabs. Scabies are mites that burrow under the skin, while pubic lice are small insects that infest body hair, especially around the genital area. Both cause intense itching and are spread through close personal contact, including sexual contact. Fortunately, they're more annoying than dangerous and can be treated with topical creams or lotions. And then there's specifically those that cause non-gonococcal urethritis. Mycoplasms are unique bacteria that lack a cell wall, making them resistant to some antibiotics. This one refers to inflammation of the urethra not caused by gonorrhea. It can cause symptoms like burning during urination or discharge, but often the symptoms are mild or go unnoticed. Proper diagnosis and targeted antibiotics are essential for effective treatment. Finally, we have the protozoan infections like trichomoniasis, often just called trich. Trichomoniasis is caused by a tiny parasite and is more common than you might think. It often affects people with a vagina more than those with a penis and can cause itching, burning, and a frothy, unusual discharge. However, many people don't have any symptoms at all, which is why it's so common. The good news is that trick is very treatable with a single dose of antibiotics. And while these are the most common STIs, there are others worth mentioning, like hepatitis C, which can be transmitted sexually, especially among men who have sex with other men or people who share needles. And bacteria vaginosis, or BV, which isn't technically an STI but is often linked to sexual activity, can increase the risk of other STIs. So there you have it. That's just a quick tour of different types of STIs, from bacteria and viruses to fungi and parasites. Understanding these infections helps us provide better care and advice to our clients. Remember, the goal is that we want to treat these infections, but also prevent them through education, testing, and when possible, vaccination. When we know more, we can do more to help keep our clients and our community safe. And hey, your clients will feel a lot better knowing that they have someone on their side who understands these things and they can talk about them openly and respectfully. So let's take a closer look at the epidemiology of sexually transmitted infections to understand the current landscape. This includes examining the incidence and prevalence rates, key demographics affected, signs, symptoms, and available treatments. So currently, STIs are on the rise globally, with some notable increases in specific regions and populations. For example, a recent World Health Organization report highlighted that syphilis cases among adults aged 15 to 49 increased by over 1 million in 2022, reaching a total of 8 million cases globally. Syphilis is one of 4 curable STIs, along with gonorrhea, chlamydia, and trichomoniasis, that account for over 1 million infections daily worldwide. Meanwhile, multi-resistant gonorrhea is becoming a significant concern, with increasing resistance to the last line of treatment that's being reported in several countries. This surge underscores the ongoing challenge of STI management in many regions, particularly in the Americas and Africa, where the highest increases have been observed. At a more localized level, data from the Centers for Disease Control and Prevention, or the CDC, indicate that in 2022, more than 2.5 million STI cases, including syphilis, gonorrhea, and chlamydia, were reported in the United States alone. And this is likely an undercount due to limited access for testing, particularly in rural areas. Specific areas like Texas and Arizona are seeing some of the highest rates of congenital syphilis, a preventable condition if infection is treated in a timely manner. Unfortunately, these states face budget cuts that may reduce the number of public health workers tracking and managing these infections, which could worsen the situation. STIs do not affect all groups equally. Young people aged 15 to 24 make up a significant proportion of new STI cases, especially for chlamydia and gonorrhea. Additionally, there are notable disparities based on race and ethnicity. Black, Hispanic, and Indigenous communities experience higher rates of STIs compared to white populations due to a range of factors, including limited access to healthcare, social determinants of health, and systemic inequalities. STIs can present in various ways, and many are asymptomatic, making it easy for infections to spread unknowingly. And when symptoms do appear, they can include unusual discharge, painful urination, sores or bumps on the genitals, itching, irritation, and even flu-like symptoms such as fever or swollen glands. Some infections, like syphilis, go through stages with different symptoms: a painless sore at first, followed by a rash, mucosal lesions, and eventually severe complications like neurological or cardiovascular problems if untreated. Recognizing these signs early is key to effective treatment and prevention of future spread. So we're going to focus on syphilis, gonorrhea, and chlamydia, and just because they're some of the most reported bacterial STIs. So as far as syphilis goes, this infection has been increasing steadily, with rates now at the highest level since the 1950s. It can cause devastating health outcomes if untreated, including heart and brain damage, blindness, congenital syphilis in newborns, which can result in stillbirth or severe lifelong disabilities. Gonorrhea is also increasing in cases, which is concerning, especially with the rising antibiotic resistance. Multi-drug resistant strains have been reported in several countries, and the CDC has updated treatment guidelines to address these challenges. Chlamydia is often called the silent infection because it frequently has no symptoms, particularly in women, but it can lead to serious complications like pelvic inflammatory disease and infertility if not treated. Then the viral STIs like herpes, HPV, hepatitis B, they continue to be significant public health concerns. Herpes can cause painful sores, and reoccurring outbreaks. HPV can lead to genital warts and cancers. While vaccines exist for prevention, there's no cure once infected. Hepatitis B affects the liver and can lead to chronic liver diseases or liver cancers. And then the non-viral STIs like the trichomoniasis that I talked about, it's more common. It often presents with no symptoms or mild irritation and can be transmitted easily and treated with antibiotics. So, treatment depends on the type of STI. So, remember that bacterial infections like syphilis, gonorrhea, and chlamydia can be cured with antibiotics, but viral infections won't work for antibiotics. So, it's crucial to catch them early. For viral STIs such as herpes, HPV, treatments focus on managing symptoms since there is no cure. Vaccines are available for HPV and hepatitis B, providing effective prevention. Recent reports highlight the growing challenge of STI management. So, for instance, a report from the World Health Organization noted a significant increase in new syphilis cases during the COVID-19 pandemic, with associated maternal and congenital syphilis cases rising due to disruptions in health services. In the US, syphilis surged by 17% in just 1 year, reaching the highest level since the 1950s. And these cases underline the critical need for continued investment in STI prevention and treatment, including better screening, contact tracing, and public health funding to curb this alarming trend. In summary, understanding the current epidemiology of STIs helps us identify who is most at risk, recognize symptoms early, and implement effective prevention and treatment strategies. Your role is in educating clients, promoting routine screening, and providing timely treatment. It's more important than ever to fight against these infections. So, when discussing sexually transmitted infections with our clients, the goal is to create a safe, non judgmental space where they feel comfortable asking questions and getting the information they need. It's about meeting them where they are, providing clear, honest guidance, and empowering them to take control of their sexual health. And here's how we can effectively talk to them about STI prevention. We're going to start with empathy and education. Begin by acknowledging that talking about STIs can be really uncomfortable and sometimes intimidating. So let your clients know that it's okay to have questions or concerns and that you're there to help. A warm, open, and empathetic approach sets the stage for a more productive conversation. And you could say something like, I know conversations about sexual health can be a little awkward, but they're so important. I'm here to answer any questions you might have and help you understand how to stay safe and healthy. And explain how STIs are transmitted and the importance of regular testing, even if someone feels fine. Emphasize that many STIs don't show symptoms, so the only way to know for sure is through screening. Encourage routine screenings as a normal part of healthcare, like getting a yearly checkup or a dental exam. And then we're going to use plain language and real life examples. So avoid medical jargon and keep the language simple. So, for example, you could say something like STIs are infections that you can get through sexual contact, like vaginal, oral, or anal sex. And the good news is that many STIs can be treated or managed if caught early. The key is knowing your status, getting tested regularly, and talking openly with your partner about protection and safe sex practices. And then we're going to discuss safer sexual practices without judgment. When talking about safe sex practices like using condoms or dental dams, focus on the benefits rather than the risks alone. So, using condoms and dental dams can really reduce the risk of passing STIs between partners. It's like wearing a seatbelt. Most of the time, you might not need it, but when you do, you'll be glad that it's there. Encourage open communication between partners about STI status and protection. This can be a great opportunity to discuss setting healthy boundaries, understanding consent, and ensuring that partners are comfortable and informed. And then we're going to encourage routine screening and early detection. Explain that routine screening is essential for everyone who is sexually active, not just those with symptoms. Normalize STI testing as part of regular healthcare. Getting tested regularly is a normal and responsible part of taking care of your health. Think of it like any other routine checkup. It's about knowing your status so you can stay healthy and protect those around you. provide clear guidance on how often someone should get tested based on risk factors such as having new or multiple partners, engaging in unprotected sex, or if they're a demographic group with higher prevalence rates. You're going to want to promote vaccination and other preventive measures. Highlight the importance of vaccines in preventing certain STIs like HPV and hepatitis B. You could say something like, vaccines are available for some STIs like HPV and hepatitis B, but they're incredibly effective. If you haven't been vaccinated, it's worth considering to protect yourself. And discuss other prevention methods such as PrEP for HIV or prevention or PEP after potential exposure. Explain these options in a way that feels accessible and practical, and you'll learn about PrEP and HIV in another training. You're going to want to use positive reinforcement and just normalize that conversations about STI are normal. Encourage clients by praising them for taking steps to protect their health. I'm really glad that you're here today and taking charge of your health by talking about this. It shows that you care about yourself and your partners, which is so important. Normalize discussions about sexual health and assure clients that they're not alone in these concerns. You can say something like, lots of people have questions about STIs. It's a common topic, and I'm here to help you feel more confident about your sexual health. You're going to address stigma and encourage openness. So, by talking openly about STIs, it lessens the stigma surrounding them and emphasizes that there's no shame in having an STI or seeking help. Reassure clients that they can speak freely with you. And lastly, we're going to provide resources and follow up. So, ensure that clients know where they can get tested, vaccinated, or seek help if needed. Share information about local clinics, support groups, or online resources where they can learn more. You're going to encourage follow-up visits and check in on their health and provide ongoing support, and make sure that they leave feeling informed, empowered, and supported. So, when working in a substance use treatment center, it's essential to understand the specific legal and ethical considerations regarding sexually transmitted infections. Confidentiality, reporting, and informed consent are key areas where federal and Pennsylvania specific laws apply. And let's break down how these laws and ethical standards directly impact our work with clients around STI prevention, testing, and treatment. So, confidentiality is the cornerstone of our work, especially when dealing with sensitive health information like STI status. The Health Insurance Portability and Accountability Act, or HIPAA, and 42 CFR Part 2 provide federal protection for all health information, including STIs. These regulations prohibit us from disclosing any STI-related information without explicit written consent from the client, except in certain conditions. In Pennsylvania, state laws further reinforce these confidentiality protections. For instance, under the Pennsylvania Confidentiality of HIV-Related Information Act, HIV-related information is given specific special protection, and any disclosure requires specific written consent. This principle also extends to other STIs as they're considered part of the client's private health information. Disclosing a client's STI status without consent, even to other healthcare providers, can result in severe legal consequences. In the context of STIs, obtaining informed consent is crucial before conducting any test or sharing information. Clients must provide explicit written consent before we can perform STI testing or disclose their STI status to others. Consent must be specific, detailing what information can be shared with whom and for what purpose. There are limited exceptions where disclosure without consent is legally permitted, and that might include public health requirements. So in Pennsylvania, certain STI cases like syphilis, gonorrhea, and chlamydia must be reported to the local health department for public health surveillance. However, even in those cases, the information reported is for public health purposes and is not disclosed to unauthorized parties. The client should be informed that reporting is a legal requirement and reassured that their identity and information remain confidential within the public health system. In the event of a medical emergency, if the client's STI poses a direct threat to their health or to the health of others, for instance, if they're pregnant or have an untreated infection that could harm the baby, healthcare providers may need to share information with medical personnel to manage the situation safely. And while most STI-related information is confidential, there are specific instances where mandated reporting laws come into play. If an STI is detected in a minor and there's reasonable suspicion that the infection resulted from abuse or neglect, we are legally required to report this to child under the Child Protective Services law. Even if the information was shared confidentially during treatment, our duty to protect the child overrides confidentiality rules. For rape and sexual assault, for adults, Pennsylvania does not mandate report of rape or sexual assault unless the client chooses to do so. If a client discloses an STI that may have been resulted from sexual assault, it's up to them to decide whether to report the assault to law enforcement. We should support their decision, provide them with information on their rights, and help them access the necessary resources. However, if the client is a minor, mandatory child abuse reporting requirements do apply. And under Pennsylvania law, healthcare providers are required to report certain STIs to the Pennsylvania Department of Health, and this includes cases of syphilis, gonorrhea, and chlamydia. And the purpose is to track the spread of these infections and control outbreaks, not to disclose client identities publicly. Beyond legal requirements, our ethical obligations involve respecting client autonomy and privacy while ensuring their safety and the safety of others. Here's how to approach these conversations. Always seek the client's consent before disclosing information about their STI status, even to other healthcare providers. Ensure they understand what they're consenting to and that their decision is respected. Let clients know that their information is confidential and will only be shared when absolutely necessary according to the law. This builds trust and encourages more open communication about their health concerns. While we respect confidentiality, we should also encourage clients to inform their partners if they have an STI. Explain the importance of partner notification for preventing future transmission and to offer and assist with this process if needed. In some cases, testing and disclosure requirements may vary. So, as we discuss consent, autonomy, and ethics in the context of sexually transmitted infections, it's essential to acknowledge one of the most egregious violations of these principles. The Tuskegee syphilis study was a painful example of how racism and bias have historically shaped medical research and healthcare. Beginning in 1932, the Tuskegee study was conducted by the U.S. Public Health Service and involved 600 Black men in Alabama, the majority of whom were poor, sharecroppers, and uneducated. Of these, 399 had syphilis, but were never informed of their diagnosis. Instead, they were falsely told that they were being treated for bad blood, a vague term that covered a range of ailments at the time. In reality, the purpose of the study was to observe the progression of untreated syphilis. The men were never given a chance to provide informed consent, and even after penicillin was widely recognized as an effective treatment for syphilis in the 1940s, they were deliberately denied treatment to continue the study's objectives. The study is an example of how racism and the medical exploitation intersected to deny Black men their autonomy and basic human rights. The researchers treated the men not as patients deserving care, but as subjects to be exploited for data, reinforcing a long history of systemic racism in healthcare. The men were denied the opportunity to make informed, self-directed choices about their health, and their suffering was prolonged for the sake of research that disregarded their humanity. The Tuskegee syphilis study remains a crucial lesson for all of us in healthcare. It highlights the dangers of racial bias, stigma, and unethical medical practices. And I think it also offers a beautiful lesson about the importance of trust in the patient-provider relationship, especially in marginalized communities that have historically been mistreated and neglected by the healthcare system. We're here for the healing nature of the relationship in addition to connecting our clients to evidence-based medical treatments for these diseases. We must always prioritize informed consent, respect for autonomy, and transparent, honest communication. And these are not just ethical obligations, they are essential to repairing the harms of the past and preventing future injustices. We can do better than Tuskegee. We can commit ourselves to never allowing such abuses to occur again and to confronting the biases of racism that still exist within our systems today. You might find that your client would benefit from some advocacy, or maybe they just need a safe person to go to. Maybe they need help scheduling or attending a medical appointment. Maybe you might go with them. As much as I'd like to say that every professional has learned not to act out of bias, racism, or stigma, We know that just isn't the truth, so it's worth considering. How might you be an advocate for your client? So, when working with clients around STIs, remember the following. Always explain confidentiality laws and their rights regarding STI testing and information sharing. Obtain explicit written consent for any disclosures and document this carefully. Know the mandatory reporting requirements and be prepared to explain them to your clients. And encourage responsible behavior without judgment, offering support for notifying partners and understanding the importance of treatment. And in this next activity, you'll be working through an interactive case study designed to help you apply what you've learned in a hypothetical situation. This is a work of fiction. Any similarity to actual persons, living or dead, or actual events is purely coincidental. You'll be asked to answer a mix of multiple choice and short answer questions, and this quiz is just designed to help you think critically and apply your knowledge to practical examples. And as you go through the questions, you'll receive immediate feedback and help clarify any points and reinforce key concepts. So if you need time to think or discuss with a partner or your team, you can pause the video before I start in with the spoiler alert answer. And once you know the answer, just say it out loud. I won't hear you, but the people around you will, and will judge you if you get it wrong. So let's get started and see how you can use your new knowledge in the fake real world. The scenario is a 45-year-old female with a history of homelessness and substance use presents with symptoms of a persistent cough and night sweats. She also reports having multiple sexual partners. Initial testing reveals that she has a positive TB test and a chlamydia infection. So the first question: what are the primary risk factors that might have contributed to this client's co-infections of TB and chlamydia? Crowded living conditions, substance use, multiple sexual partners, or all of the above? And the answer is D, all of the above. All three of these could definitely have contributed to this client's co-infection. So how should the healthcare provider approach treatment in this case? You're going to want to consider both infections and the client's overall health condition. And pause here if you need time to think. Because the answer is that to support this client, we would encourage her to seek treatment for tuberculosis with antibiotics and help ensure that she follows through with her treatment by offering additional support, like attending medical visits with her, checking in with her about her treatment and attendance, or helping her find treatment close to her home, perhaps transportation too, if that's a barrier. She'll also need treated for chlamydia infection and encouraged to notify her sexual partners so they can get treated too. And given her history of homelessness and substance use, it's important that we connect her with other resources for housing, for substance use counseling, and we'll offer screenings for other infections and provide education on staying healthy, including information about TB prevention and sexual health. And then our third and last question is, what advice should the healthcare provider give the client regarding prevention of future transmission of TB and STIs? Encourage the use of condoms during sexual activity, recommend completing the full course of antibiotics, advise on avoiding close contact with others until TB is no longer infectious, or D, all of the above. And the answer again is D, all of the above. So as we wrap up this part of the training, let's take a moment to recap the key takeaways. Today we've covered the intersection of tuberculosis and sexually transmitted infections, exploring how these conditions often share common risk factors and affect similar populations. We discussed the importance of a holistic approach to prevention and treatment, which includes understanding both the medical and social context of these infections. We also emphasized the critical role of effective communication and confidentiality in managing these infections within our practice. To help you continue learning and staying informed, I compiled a list of resources for further information: Centers for Disease Control, World Health Organization, Pennsylvania Department of Health, and there's also some online courses and webinars, so you might consider enrolling in additional courses or webinars focusing on infectious diseases, patient communication, and public health strategies. And remember that vigilance and education is key. TB and STIs continue to be significant public health concerns, but staying informed, following best practices, and fostering open and supportive communication with our clients, we can make a real difference. And I encourage you to keep building your knowledge, stay aware of emerging trends and updates, and continue advocating for the health and well-being of your community. Thank you for your participation in this part of the training. Your commitment to learning and growth is invaluable in our collective effort to combat TB, STIs, and other related health issues. Keep up the great work, and let's continue moving forward together to create a healthier future. And up next in part 3, we're going to talk about hepatitis.